We will be examining early childhood interventions, specifically Connecticut's Birth-to-3 program. We will provide a little background information about how and why such programs came to be. Connecticut's Birth-to-3 and similar programs stem from the Individuals with Disabilities Education Act, Part C. In short, this federal act supports states in providing early intervention services for infants and toddlers with disabilities under the age of 3 and mandates that states must coordinate a comprehensive system to deliver free, appropriate public education services to children who demonstrate atypical development or are at risk of developing disabilities with one or more of the 5 domains: physical, cognitive, communication, adaptive, and social or emotional development. Research indicates that the earlier a child is identified as having a developmental delay or disability, the greater the likelihood that the child will benefit from early intervention. Early childhood intervention can be defined as the experiences and opportunities afforded infants and toddlers with disabilities by the children's parents and other primary caregivers, including service providers, that are intended to promote the children's acquisition and use of behavioral competencies to shape and influence their pro-social interactions with people and objects. Services are provided within the natural learning environment, which supports the family-centered approach of these programs. Since its inception in 1996, Connecticut's Birth-to-3 system has provided services to more than 165,000 families. In fiscal year 2017, over 10,000 children were served through Connecticut's Birth-to-3 services. Here, you can see an informational flyer for the Birth-to-3 program offered through the Wheeler Clinic. Reported outcomes suggest that nearly 3/4 of children who received services in fiscal year 2015 benefited from the program and were able to catch up with their same age peers in social-emotional skill development. Families can access services through self-referral or through a referral by a community provider, such as a pediatrician. Families referred to a program will have an initial assessment to determine eligibility. Some assessment tools that are commonly utilized are listed on this slide. Within 45 days of the referral, an individualized family service plan is developed. The plan is reviewed at least every 6 months, and once a family is enrolled in services, the family will remain eligible until they meet exit criteria. In creating the Individualized Family Service Plan, or IFSP, the service provider team gathers information including the following that is listed on this slide. IDEA Part C and Birth-to-3 programs stem from research that indicates best practices for quality early intervention services. Birth-to-3 programs are based on a family-centered approach that assumes that child, parent, and family functioning interact in multifaceted and dynamic ways, and parent engagement is crucial in healthy development. Because children spend most of their time with their parents and families, not with service providers, families are considered an integral, constant component in supporting children's development. The program also considers the importance of treating families with dignity and respect to provide them with resources and supports to promote overall better functioning. Birth-to-3 programs also reflect the short attention span and active learning style of most infants and young children. Effective interventions should prioritize learning through children's everyday activities and experiences and stray away from isolated, episodic, and structured time-intensive interventions. Finally, Birth-to-3 programs stem from research from multiple domains that influence and impact child development. Services should be delivered through a team approach with discipline-specific professionals that span developmental and behavioral domains. The 7 key principles of Connecticut's Birth-to-3 program are listed on the slide for your review. So to tie this all together, Birth-to-3 programs deliver collaborative services within a child's natural learning environment and include a professional team with one lead interventionist who serves as the primary support for the family. The service team utilizes coaching to strengthen parents' confidence and competence, in addition to building a network of supports to promote positive outcomes in the child's learning and development. A total of 9,462 referrals were received in fiscal year 2017. Most children were referred by their own families or by their medical provider. Families who did not already know about Birth to 3 supports learned about them from a trusted healthcare provider, relative, friend, coworker, social service, education, or child care provider. 65% of the children referred were boys, and the median age at referral was 21 months. Here we see that 90% of the children referred had a significant developmental delay. 10% had been diagnosed with a medical condition that would likely result in a developmental delay. Of that 10%, 125 children were born prematurely, 117 children had brain or spinal abnormalities, 69 children were deaf or hard of hearing, 67 had neurological conditions, 61 had infections, 51 children had autism spectrum disorders, 48 children had Down syndrome, 35 children had chromosome or metabolic disorders other than Down syndrome, 21 children had cleft palates, 6 children were blind or visually impaired, and 3 had other medical conditions. Of children served, here are some positive outcomes that were taken from the Birth to 3 website. Of the families served, here are some positive outcomes taken from the Birth to 3 website. We'd also like to note that the entire family benefits from the overall support and increased confidence that is gained through Birth to 3 interventions. Within the Birth to 3 system, social workers play a variety of roles, from initial assessments to counseling to linking families to additional resources. From a micro level to the macro level of social work practice, early experiences shape an individual's areas of functioning. Within the Birth to 3 system, in addition to social workers, there are numerous professional positions. Here is a list for your review. An interventionist functions as the primary support for the family. Each child is assigned a full team of staff that are trained, licensed, or certified. Below is a list of risk factors that may contribute to a child needing an early childhood intervention program, such as Birth to 3. And who needs Birth to 3 the most? Children with disabilities in our most vulnerable populations. We began our presentation stating that IDEA mandates that states deliver appropriate public education services to children who are at risk. Unfortunately, in some situations, there are barriers to accessing services. A predominant barrier to accessing programs or early interventions is maternal depression. Here are some questions for discussion. Thank you for viewing our presentation, and for more information on Birth to 3 services in Connecticut, please visit www.birth23.org.